Good afternoon, everyone. We're doing what is either a weekly or twice a week Town of Randolph coronavirus update. As I always indicate to folks, make sure you do subscribe to the town's Facebook page, that you sign up for the town's daily emails on the town website. In addition to that, we have the HyperReach system, which we will call or text you certain information that is deemed an emergency in nature. So go to the town's website and sign up for HyperReach. Those are three great ways to make sure that you continue to be able to get the most up-to-date information available. Today's update is specific to the COVID-19 testing site that will open up on Monday. Just a little bit of history here. My emergency management team, which is made up of Chief Donovan, Commissioner Gerard Cody, Health Commissioner, our town clerk, Cheryl Sass, our police chief, William Pace, and our director of library, RICC and community programs, Liz LaRossi. One of the things we've been working the hardest on was getting a testing site here in Randolph. Obviously, I am tremendously happy that we're able to work with Beth Israel Lahey Health, in particular the Milton location, to get the site open. I will say, and maybe it'll be a year from now, I'll probably write a little book about my thoughts about how the state has worked and communicated with the local municipalities. I will say that to have a community that was originally number 3, number 5, and still number 7 in the state, and it took this long for us to be able to get a testing site, and they announced yesterday that there's a series of CVS's across the state in areas that aren't even remotely impacted the way that Randolph has. Obviously, I'm happy for those communities, but I still just do not understand how other communities were able to go to asymptomatic testing before we had a site. I don't understand how other communities that have not been impacted like Randolph have gotten sites at the same time that we have. There's just things in this process that have been extremely frustrating, and I cannot thank enough my team, Beth Israel Lahey Health, also Senator Walter Timilty, Congresswoman Ayanna Presley has been working, her team has been great in working with us. Obviously, my emergency management team, Beth Israel Deaconess President Rich Fernandez, and we are lucky enough to have a member of the town of Randolph who's on the Board of Trustees, Alexandra Alexopoulos. So I certainly want to thank them. The town council has continued to support my efforts in getting a testing site. My goal is that this site, which will start for symptomatic testing only, will be able to transition to asymptomatic symptomatic testing, and we'll go over that in a moment. Jerry, we put together a little slide presentation to go over the details, so I will have you take it away. I will run the slides from here. Hopefully I do you justice as I go forward here. So
very good. Thank you, Mr. Town Manager. I just wanted to start out with some numbers from the state. So we had 82,182 confirmed cases statewide as of yesterday, and 424,361 have been tested. So that gives us 19% of those who are tested are positive. If you recall, the last 2 weeks I gave you similar updates, and we were at 22%. Last week we're at 21%. Now we're at 19%. So that means we're doing more testing statewide. And as you can see in Randolph, we're also starting to test. So today we did a trial run with our testing site. Things went really well today. We had 12 people go through and were tested. It's a small number compared to what can happen on a normal day. So with this testing site, they have the capability to test up to 200 people per day. And this presentation will give you some tips on how to get tested, and it'll have some photos of what that process will look like. So in case you do need to come out to get tested, you'll be familiar with the layout. So the test site here is for Randolph residents only, and it's by appointment. The testing is done by a common phrase called PCR. So that's a way to test the DNA of the virus. It's a polymerase chain reaction. And it also goes in through your nostrils. So it's a nasopharyngeal swab. So it's like a Q-tip, if you will, that is put up in through your nostril to collect the sample so that they can extract the DNA from the virus. And all of this is done in a vehicle. So it's an outdoor, they call it a drive-through site. So the patient remains in the vehicle and drives through the tent in the parking lot. There's a pre-registration process, and this number I want you to write down. It's 781-607-4355. So that's 781-607-4355. So this number is answered from 10 a.m. until 4 p.m., Monday through Friday. So if you call now, you cannot leave a message. I don't know if there'll be a voicemail on there, but it'll be answered Monday through Friday, 10 a.m. until 4 p.m., and that's how you make your appointment. So who would get tested? You would have to have symptoms. And I think we all know what the symptoms are, but this slide will review those symptoms with you. You need to have a fever of 100.4. You need to have maybe chills or body aches, so that would be considered all part of the fever. You'd have to have respiratory illness, meaning you have trouble breathing. You may have a cough or a difficulty breathing, a real shortness of breath, you can't catch your breath, or you might have a sore throat. Other symptoms that we've known to be related are abdominal pain. You have a stomach ache. You're nauseous. You may feel like you might be able to vomit, or you may have diarrhea. Another symptom is you may be tired. You may have unusual fatigue, and it came on suddenly, and you normally don't feel that way. Or you could have a loss of senses, such as smell or taste. So right now, those are the groups that we're trying to capture to make it a priority to get tested here in Randolph.
And I just want to follow up real quickly, Commissioner, that this is symptomatic testing only at this point. One of our goals is to transition to asymptomatic. When the state provides us the tests, they give us guidelines we have to follow. Brookline and Somerville were given looser restrictions. They are able to test asymptomatic. We are hoping that we are going to get that in the future, but at this point, it is symptomatic patients only.
Yes, agreed. Very good. So we have a site overview. If you're familiar with the site, it's almost directly across from the town administration building of the town hall. And you would enter nearest the entrance closest to the bank. It's the one that's right across from the BI Leahy clinic that they have on site there. And you can see the tents in the middle, and then you would exit on the other end. The big red portion on the far end is where you would be sent for screening if there was a problem with your registration process, or if you needed to see a nurse before you went into the tent area. Next slide, please, for registration. Again, all the phones are answered across the street at 32 South Main Street for this. They're going to have 4 people answering the phones on Monday morning. between 10 a.m. to 4 p.m. And again, that number is 781-607-4355. So when you call to register, you're going to be asked several questions. Are you a Randolph resident? We want this exclusively for Randolph residents. We worked very hard to get this, and the town deserves that. And we're going to ask, what are your symptoms? And we went over the symptoms a few minutes ago. And if you do have symptoms, they'll ask you further questions like your name, address, insurance information. If you do not have health insurance, you may still be tested, and they'll give you further instructions. And there'll be interpreters in various languages to help you with the registration process as well when you call that number. So after you've completed your registration, they'll give you a time to come by, and again, it'll be any time between 10 a.m. to 4 p.m. We ask you not to show up without an appointment. So the greeter will ask you what time your appointment is, and if you're early, they may ask you to wait, or if they're able to take you, they may take you, but most likely they want to stick to their schedule. They may just ask you to pull over to the side for a few minutes or to drive around the block and come back. But the greeter, if you just follow their directions, that would be most useful. And they'll give you a bag with some additional documentation for the tent area. So you would just drive straight ahead into the testing tent after you've met the greeter. And we have some photos up here of what it would look like. These were taken at about 11 a.m. this morning as they were practicing the work in the tent. And I do say it has pretty good flow, it looked very efficient, and everyone was wearing their personal protective equipment properly, and they had plenty of supplies. So the appointments are between 10 a.m. to 4 p.m., and they can test people about every 5 minutes is what they're telling us. Now, one thing that's really, really important is if you're coming in a vehicle, you need to have some type of face covering. We want to protect the healthcare workers, and if you have a passenger or if you're driving somebody who needs to be tested, everyone in the vehicle should have some type of face covering.
And I think it's a few things to mention that go into this flow is that they would like you to limit those who are in the car. If you are in a situation where you can drive yourself, that's the best situation. And for a lot of these symptoms, you could drive yourself. But otherwise, please limit the amount of folks that are in the vehicle. And those that are in the vehicle, everybody has to have a face covering. At this point, we want you to schedule your appointment. No walk-ins is a very critical part of this process. As we get more information, we're going to pass it on. A couple of quick questions that were asked online. PCP options say you have your own private care provider. My understanding is that they are going to be opening it up to other providers who they would be able to call into the network and schedule you for Randolph. That is not necessarily in case right now, but if you call your personal care doctor, your PCP, you could certainly ask, and they can see whether or not they have that ability to have you tested at the Randolph site. There was another question that was asked about the location. I know we've mentioned a few times, but it is directly across from the town hall. Beth Israel has a location there already. One of the nice things about this location is that all of the information, the computer networks, the phones, everything that's necessary to operate this site effectively is right there. And that just makes it so much of a smoother process. So those are some of the considerations that were made.
So what happens next? If you test positive, you'll receive a phone call within 24 to 48 hours. So that means you go into isolation immediately. I would even say if you are getting tested and you have symptoms, you need to be in isolation. We don't want this to spread any further than it needs to be. This is such a contagious disease. If you're negative, you'll get a letter within 7 days. So that's good. You'll know that if you don't get a call right away, that means you tested negative, but feel free to call back if you have any questions. Now, the Randolph Public Health Department, if you had any questions, you can reach the office at 781-961-0924. So that's 781-961-0924. And to make the appointment, you would call 781-607-4355. And that's between 10 a.m. to 4 p.m., Monday through Friday.
Thank you, Jerry. At this point, I would like to introduce our Fire Chief, Richard Donovan. First off, Chief, you've been one of our main contacts with their operations folks, and, thank you and the department for everything you folks have been doing. It's been amazing to be on these Zoom meetings with the folks from Beth Israel Deaconess. They know their stuff.
Yeah.
Their operations team, their medical team. It's impressive, these meetings that we've had with them. Chief, if you want to touch upon anything going on with the department or any information in regards to our testing site, that'd be great.
Yeah, I would like to follow up just with that. We were able to mesh very easily with our team and their team on the Zoom meetings, and got a lot accomplished, I think, in less than 5 days. We stood up a testing site, and that's, I think, a credit to the Randolph team as well as the Beth Israel Leahy health team. So just as Mr. Howard said, we've been continuing to aggressively track PPE sources for utilization by our personnel. MEMA, the Massachusetts Emergency Management Agency, has done an incredible job of keeping us supplied, not only the fire department, but the police department as well. So we're able to, we actually have enough PPE probably at least for a month going forward, which is a good thing. To date, my department has only had one member affected by the virus. Fire departments across the state have been hit significantly worse. We were lucky enough to get on this right away and protect our people and get the PPE in place. So it definitely helped us stave off, more infections. I'd like to once again recognize our firefighters are out there every day as they treat and transport individuals either affected, non-affected, or by this virus, or just have any type of emergency, be it medical or anything else, that we're there to help them. I was able to actually witness them today. I don't get to a lot of medical calls as I'm doing other office duties, but I was able to witness them today just before we came on, where they had a COVID case, and it was surreal, sort of, to watch the men and women help each other get into their PPE, wear gowns, wear masks, and then attend to the patient. It's, I know that I've been functioning and getting PPE and getting everything straightened out for the organization, but like I said, I don't get out there to these medical calls and see what's actually going on. And they, they've taken this and they've really just ran with the ball and done a great job. So, thank you.
And I think that's something where, because Randolph Fire runs the ambulance and our paramedics, a lot of folks probably don't realize how lucky we are, in the sense that in a lot of communities, they outsource the ambulance, so this whole component is being done by a private vendor.
Right.
Ours is a lot more complicated.
Right.
And the expertise of the individuals within the department has really, shined through. So that has been impressive to watch,
Definitely has, Mr. Howard.
without a doubt.
Thank you.
I do want to mention a few other items. On Monday, Governor Baker will be announcing the reopening plan. I wish I could say that as a local municipal leader, that we've been given any additional information to give us some guidance. We have a lot of businesses in the town that have been reaching out to myself and to the health department and to the police and fire, wanting to know, okay, can we open Monday? We don't know. We only know what was released last week, and I think the information that was provided allowed businesses to start to acquire, in some cases, PPE for their job sites if necessary, disinfectants and/or hand washing opportunities that they may not have needed, or additional ones, and see if they can handle the 6 feet difference between individuals that's expected to continue. But we don't have any additional information than what has been provided to the public. It is something where we will take the information. The governor's office generally gets it out onto their website very quickly, but we're going to be analyzing it internally. We're going to do everything we can to work with every business that reaches out to us and has any questions and needs to have their plan looked at by the emergency management team. We want to support the local businesses. They've had to deal with quite a bit in this. I always think about, and I've mentioned a few times, the Jamaican restaurant, The Well, pouring their life savings into this business, and just before they open it, the pandemic hits. And they've not been able to hit the ground running the way that they wanted to. And even with that, they continued to do donations to the general public on Saturdays, food donations. So as soon as we get information on Monday, we're going to be going through it, we're going to be analyzing it, and we're going to do everything we can to support our local businesses during this time. I also want to note Beth Israel Leahy was very helpful in creating education that is given out to folks after they get tested. We're going to put these up on the website. These are extremely well done. I think that whether or not you are tested or not, some of this information we've been passing along, but I think they've done a great job in how they present it, and we're going to get that out to the town's website. And that speaks to the key to this. There are folks that are asymptomatic, so when you go shopping, when you go to pick up a meal at the local restaurant, when you go into a convenience store, there are strong possibilities that somebody who is COVID positive, asymptomatic, is with you or around you. You have to continue to be diligent. You have to continue to follow good hygiene. You've got to wear your face covering. Certainly you can use Purell, which we have. We're running very low, but we're still got a little bit of Purell left here at the town hall. But in particular, wash your hands, soap and water, warm, for at least 30 minutes. 30 minutes. Feels like that the way my hands are. 30 seconds.
You do all day is 30 minutes, you're washing your hands.
That would explain a lot, wouldn't it? So also next week, once we digest the plan from the governor's office, we will release some information. I will say that based on the action taken by other municipalities, and I think based on the decisions of our public safety and our public health, folks, I think at this point have assumed that the parade and fireworks will not be occurring, and that would be ultimately true for various reasons. Number one, it's at this point just not safe to do it. Number two, with all of the communities around us, from the Brockton Fair being canceled and their fireworks, Braintree Day, their firework and parade canceled, Plymouth 400 celebration canceled, Boston. I think that even if we were able to hold a parade and fireworks, the public safety situation of all the other communities if we were the only one holding it. It would not be something that would be in the town's best interest from a public safety standpoint, clearly. In addition to that, in running the parade and the fireworks, there are a lot of donations that we seek, but we've been tapping those donations for the food pantry, and on Monday, we're going to have another announcement that will be exciting on other ways to help Randolph residents. And in addition, the RICC staff at this point is doing yeoman's work in reaching out to the seniors, providing rides to the seniors, and also assisting Jerry in your office for folks who are COVID positive and need food delivered. To take those people off those critical things to plan a parade, I just in good conscience can't do that. It's not where my priorities would be during this time frame. We have done a bit of research. Liz LaRossi put out a summer camp questionnaire to those that have participated in the past, based on what we expect the guidelines to be and what's going to be required. We're probably not going to be in a situation to offer summer camp this year. If we find that there are some trusted partners around us, the YMCA and STARS are two that work with the Randolph Public Schools, that may be an option for a lot of folks in town. And finally, answer your census. I talk about it all the time. The state just released funds to the community 2 days ago. We have to apply for the funds, but it was done solely on population. And those funds at this point can only be used for specific purposes. They can't be used to close revenue gaps. And that is something, as we're crafting the budget, is clear that that's going to be a significant need. But at this point, we cannot use it for that purpose. We can only use it for COVID-19 response issues. And these are items that were not budgeted by the town as of the date that the emergency order started. And there may be some flexibility given in the future by the federal government to the state, but at this time, that's just not the case. So, folks, thank you for tuning in. We have a testing facility now available through a relationship with Beth Israel Leahy Health. It is directly across from the Randolph Town Hall at the Beth Israel Deaconess office space that they've had for a number of years. This is for Randolph residents only. You must be symptomatic. You must schedule an appointment, no walk-ins. And this is a drive-through facility. Those are the key things to know. We will be back at the beginning of next week after the governor has provided more information. And we ask everybody to stay safe and stay vigilant. Thank you for tuning in.